It is 3:02 and I'll call the meeting to order. We do have a quorum. And I think I'm going to start by taking attendance. And our speaker is not here yet, so I hope he makes it. Please say yes when I call your name. Diane.
Here, oh, yes.
Rocky.
Yes.
Rocky is here. Kelsey.
Yes.
Robert is not here. Erin.
Yes.
Arlene is here. Lisa. Lisa's not here. Linda.
Here.
And Mary Ann, thank you. First thing is approval of the agenda.
So moved, Madam Chair.
Thank you. Can I have a second? Second, Arlene, thank you. Do I have to go through this for?
You do, because it's
Yes,
hybrid. You can go
every
by roll
vote.
call.
Okay, so now you're voting to approve the agenda. Diane,
Approved, yes.
Rocky,
Yes.
Kelsey,
Yes.
Erin,
Yes.
Arlene,
Yes.
Lisa, you're
Yes,
approving
yes.
the agenda.
Sorry.
Linda?
Yep.
Mary Ann, yes. Do I have to read this script?
No,
Okay.
No,
basically just
not
let
anymore.
everyone, yeah, just let everyone know, as best practices, just let everyone know that it's a hybrid meeting, and that you're being recorded, so please be careful of what you're sharing, and that all votes must be done by roll call. There, done.
So you all heard
There you
that.
go.
Thank you. We have a speaker, John Copenhaver. He's probably going to be late, I'm guessing. He's president of the NCEA, kind of our sister organization. So I'll go through other things before he arrives. I'd like to start first by welcoming our new members, Diane and Kelsey. And I'm wondering if each of you would just take a minute to introduce yourselves and tell us why you have decided to join the Council on Aging.
First,
Diane,
did you guys get
Shaheen?
sworn in? Did both of you guys get sworn in, all of you guys, at the town
Yes.
clerk's office?
Yes, I did.
Kelsey,
No,
did
I
you
didn't.
get sworn in?
No, I
All
didn't.
right,
do
so you
that. I
can't-
just got, okay. I just
Just
got
got
my
notified.
email. Yeah, they didn't send it to me until like Friday.
All right,
Yeah.
she's not a member of the group then. She is an ex officio at the moment.
You just,
Everything's been very late,
yeah,
that's for sure.
Really late, very late.
But still, it's nice to know you. So could you
Yes.
tell us about
So
yourself?
Diane Flaherty, and I was on Council on Aging about 4 years ago, and I've completed somebody's term. And then didn't run again because I didn't think I had enough time available. And I find that I have more time now. I thought one of
Welcome
those.
back.
Thank you.
Yeah, it's really nice to have you back.
And that was one of those committees that actually, I don't mean this with any insult, but actually did something. Or, had a plan and executed it. So,
And we hope that you'll force us to do the same. Kelsey, even though you're not official, do you want to introduce yourself, please, and tell us how you came to the Council on Aging?
Yeah, so Aaron recruited me to apply for an open seat, which was great. Thank you, Aaron. And I'm glad to be here. I'm a nurse here on Nantucket. I manage visiting nurses, home care, hospice, public health, and maternal child health. I work a lot with Jericho and the town, operating as part of their town nurse department. And so a lot of our work over the past 3.5 years has shifted into this public health realm, but also being a Nantucket native, it's really something that I care about, being part of and giving back to the community and thinking about the future of everybody. So I'm glad to be here.
It's
Glad
great.
you're here too. Thank you. Welcome. So John Copenhaver has arrived and he's agreed to speak to us today about NCEA's many activities because they're going gangbusters these days. And they're an organization that we rely on a lot for assistance, especially funding, but also people to team up with us in activities that we do. So John, I know that you have limited time, so I'm gonna let you take it away.
Well, thank you. Yes, I'm president of NCA, Nantucket Center for Elder Affairs, which is the people say, what is NCA? What do they do? And I look at it and I say, well, we do a lot of things, but we have two main goals. One is that we create and find programs for seniors to get seniors to socialize, to get them engaged, provide activities that seniors are interested in. And it's a valuable service to the senior community. And we also act as an advocate on senior issues. We've in the past, we've been involved with the building. We're been talking about maybe handing that over to the town, but that's another issue for another time. In the last couple of years, we have ramped up our activities significantly. Okay, there are two functions that happen in the Salt Marsh. One is the functions that are supervised and managed by the town that happen basically from 7 o'clock in the morning until 3 or 3:30 in the afternoon. And then there's all the after hours activities which are under our purview. So I view our organization as sort of, I know it sounds kind of silly, but we're sort of the PTA for seniors. Which is kind of an apt description. We raise funds, we provide sometimes equipment and things for the Salt Marsh to use. One of the things that we've been able to do is we've greatly increased the number of activities that we have, which has a follow-on effect of bringing more people into the Salt Marsh during the regular hours. I think without us, the Salt Marsh should be a less rich environment. And I was curious to what we've done. So in the last year, we've had, we're just starting to figure out how to track all this stuff. When I joined the board, it was paper and pencil and a spreadsheet. Now we have a database and we're trying to capture data, which is important, but it's not all that easy sometimes. We had 66 different events in the last year, which is, and that's an undercount because there's stuff I think that isn't on here. And we've had almost 1,100 different encounters in the events that we run. And the events, I'm not going to read them all, but I'll give you a taste of the kinds of things we've been doing. During the winter, we have a monthly dinner at various restaurants around town. And that's good for the restaurants and it's good for us because it's a socialization. And we have 30 to 40 people or more come to each of those dinners. We've been to kind of all the restaurants that are open in the winter, the Boarding House, the Anglers Club, Sorrows, My Comment, things like that. So it's been very good. We did painting classes with Kwan. Armchair theater. We've done 2 or 3 different armchair theaters each year, which has been fun. I've been in a few of those shows. We have a movie night twice a month, not in the summer, but in the off season. We have big access to a large selection of movies. We do off-island travel. This year we did, last year in the fall, we did a trip to Hyannis, and there's the Cape Cod train that goes through, and there's a lunch on the train that was very well received. We've been to a couple of Cape Cod symphonies. 2 weeks ago, we went to and we've done twice this summer, a Cape Cod League baseball game where we took a small group over to watch the ball game, which is really fun. The Cape Cod league is a very important, very famous baseball league for college ball players. 1 out of 7 major league ball players played in the Cape Cod League, including like Aaron Judge and, a lot of really great players. You see, we've done stuff like fish printing, which is a technique for creating prints of fish with one of our board members. They did a makeup day for want to get made up. I missed that one. I don't know. We try to do collaborative things. We did a deal with an event with Marai Mitchell, where the astronomer came in to do. We'd hoped to do. She brought a telescope. We were going to do is look at the sky, but it was cloudy. But we had a very good night anyway because there was a online demonstration that she was able to do. And some of these things happen by chance. Sometimes the astronomer thing happened because I was down on the beach. Getting ready to go out in my boat, and a couple walked by and they were looking at stuff in the water. I had a couple of questions what this was and that was, and we started chatting. And this was off season, and I said, what do you do? They said, well, she said, I'm the astronomer at Marai Mitchell. I said, oh, could you come talk to us? And she said, I'd love to. And she came in, and then this year, the new astronomer did the same thing, was also very well received. We did a tour of the museum with David Billings when he had his exhibit up. He had a special tour for us. We have flower arranging. We've done several sessions of that with one of our board members who's a member of the Garden Club. We do some technology stuff, chat, GTP, how to use it, here's what it's for. The summer barbecue. We're a supporter of the Senior of the Year event, which we've funded for a lot of that. Boston Pops, people don't want to get sand in their shorts, so we have an event, kind of a potluck thing at the Salt Marsh with a live feed from through NCTV to the Pops, and that's very popular. We had 50 people there last year. We have the Short Film Festival, which Nantucket does. The NCTV does the Nantucket Shorts, and we had a private viewing of the Nantucket of the Shorts Festival. Kayaking, you wouldn't think the seniors would be all that big on kayaking, but we have an inveterate person she's 84 and still kayaks, and good for her.
Good for him.
And that would be Peggy.
Of course.
It's fine. I was guessing, man. I was on the. Yeah, I think you also assisted with the Senior Expo last year, a great
Yes,
deal.
right, the Senior Expo.
And you're doing the senior reimbursement for travel. That's a huge thing.
We have, yeah,
Somebody trying
Oh,
to-
I'm sorry. iPhone.
Don't know who that is, though.
Bear with me while we figure out who this is. It has to be in the
click the button on the top right.
I got it over here.
Right here.
Maybe they're
You
like-
cannot have somebody on an iPhone on a Zoom. They have to have a name.
Yeah.
I don't know.
Linda.
I'm in my car and I'm not sure how to put my name in.
Oh, it's Robert. Okay, I can
Who is
change
it?
that for you, Robert.
Okay, no, I just coming on. Just came out of the surgeon's office.
Okay.
I'll be driving in the car with you.
All right. We work with the Community Foundation. They have a grant from the Pleasant Foundation for senior travel, which we administer. So if you're if you are over 65 or
I
60,
thought it was 60.
maybe it's 60. If you're over 60 and are a resident of Nantucket, and have, travel, expenses, we will cover them. We have limitations but that's been very, well received. What else can I say?
As one who has used it, I highly recommend it.
Yes, it works. You just have to
It
fill out
does
the paper.
work.
Yeah. And we're funding that ourselves. They're funding the payment that we're paying for the administration of it, which includes bookkeeping and a lot of time. We did line dancing.
So much time, yeah, administration.
Yeah, we have St. Patrick's Day dinner, we have Valentine's dinner, we have. And we had a barbecue last week. We have another a lobster dinner coming up next month. I'm sorry, week after next, I think it's the 19th. Anyway, so what we try to do is provide a place where seniors can go, they can feel safe, where they can see their friends, where they can help battle some of the isolation. Another thing we did is that 2 years ago, the Council on Aging, I think it was Council. No,
Elder
Sherry Hunt,
services?
yeah.
Yeah, Elder
Elder Services funds the congregate lunch. And they lost their, the person that was doing it, and they stopped doing the congregate lunch. And I went to the board and I said, we can't stop the congregate lunch. We can't be Kitty Murtaugh's, but we can do something. And for a couple of months, quite a long time, 3 months, I think.
Yeah.
We stepped up and provided soup and sandwiches that we got from Stop and Rob, excuse me. Stop and Shop.
They can hear you. You're close.
They don't.
We'll ask that to be not highlighted in the minute.
Yeah.
So, we try to be very community minded, and, it's fun to be part of, because there's a lot going on.
And I think you bring in seniors who otherwise would not come to the Salt Marsh. It's a really an add-on supplemental. Many seniors who don't come to the day programs come to your program.
Right, and some that come to our programs
And then.
and learn about the day programs,
Yeah.
and learn that they can come to
Yeah.
yoga or, or Mexican train or whatever they do, the things during the day. So.
I want to make sure people have a chance to ask you questions or make comments.
Yeah,
If any-
sure.
Anybody here who has a question for John or wants to make a comment about NCEA? Is everyone alive out there?
Yeah. Just caught in traffic on Main Street of Hyannis.
Oh, all right.
We needed that report.
Well, he didn't explain how they get the money to do all this from fundraising and whatnot, and he didn't explain their attachment to, I believe, the Landmark House, correct?
Okay, well, we get money by asking for it. We do an annual appeal. And additionally, I write grants. It's a very good question, Linda. I did get a grant from Landmark House. I've got, for programming, I got a grant from Community Foundation for programming. To help support our off-island events, which are very expensive, because it's just expensive. Ferries, buses, tickets, that kind of stuff, it adds up. I got a couple of grants from Remain, one for programming and one to help with our technology. We've purchased or enrolled in a database management thing called Boomerang, which is a system for managing your fundraising. And we're trying to create a front end to that allow us to have people sign up directly for our events online. Now that's, it's a work in progress, maybe by the end of the year, we'll see how that goes.
How is, what is your association with the Landmark House? I'm not sure everybody here knows.
Well, we don't have a direct association other than they write us grants. I mean, I've applied to grants for them, with them. And they support our programs. With the Landmark Foundation has given us some money.
And can you tell us how much you raise through your appeal each year? Because I think it's pretty successful.
Yeah, last 3 years ago, we were raising about $40,000. Last year, we raised 150, kind of, you know.
When is your annual appeal?
It goes on probably end of in November. But some of that, you know, you get lucky, you have one vendor that drops a big number on you. Which happened last year.
Fundraising is a funny thing.
Yeah, so whether I get that number next year, or I doubt it, but I think we'll do well. You know, yet you have to ask. That's where it boils down to.
Great.
And it's amazing. I don't have to tell you all this. It's amazing how much money is floating around on this island. I went to Nisha last week.
Yeah,
Whoa.
I was there too. Wasn't that astonishing?
In the
It was
news.
It was
jaw-dropping.
It was my.
I haven't been out there.
Where was this?
At
Nisha.
Nisha for the Safe Harbor for Animals,
Oh.
I mean, 1.5 million.
No, more
With
than
that,
that, more than
well,
that.
at least.
For expansion?
They're
Well,
building a
for
building
the
out by
building.
the airport. Their paddle race started at 100,000.
Wow.
I mean, two people were fighting over an auction item, they got up to like 44,000, it was a week in a house, and so the. People generously gave, you know, a week to each of them, so bid it
Somebody
up.
told me there are 75 billionaires on the island.
Yeah, well, some of them were them. They're like their dogs. They like their cats and dogs.
That's a nice round number.
Yeah, I know. Came from a good source, though.
I knew we actually probably should not digress into the wealth distribution on Nantucket during the Council on Aging, but.
That's a good idea.
But basically, there's, you know, I think we have a good message. And we're doing, I think, the right things for our seniors, and hopefully we'll be supported by the community.
Thank you.
The biggest difference between us and you, though we work very closely together on a lot of these things, is that you are a private 501c3 and we are a town entity, which means
Right.
we are limited in fundraising. We are limited in a lot of what we can do until we fix our enabling legislation from 25 to 30 years ago, which has been my bugaboo, as Mary Ann knows, for a long time, to make it more in line with mainland Council on Aging's. But we do work very closely with you, but you can do stuff we can't, which is why a lot of times we'll go to you, like for the expo, and need help for advertising and other things to get that off the ground. So they've worked very well together for some time now.
Yes, we have. And Mary Ann comes to our board meetings every month, virtually every month. And I've been remiss not coming to this before,
But
but
you're always invited.
I know, keep telling me.
Yes, if anybody has anything that you want me to mention at their board meetings, I do go there every month just to represent us and what we're doing, so just let me know.
Any other questions
John,
for John?
thank you so much. That's
Okay,
great.
my pleasure.
Yeah, Joe. I hope everyone knows about the travel grants, especially because if you know seniors who travel off island or even on island for medical purposes, this is a very generous program.
Right.
So, and so helpful, especially if you're going to Boston on a regular basis.
Right.
Yeah.
Even going to Hyannis, you know, it's,
Yeah.
if you gotta go to.
Expensive.
It's $100 round trip, easy, before any off-island travel.
Yeah.
Thank you for bringing us up to date.
Okay,
It's so impressive
Right.
what's going on.
thank you, my pleasure.
Thank you. Good to see you, John.
Okay, good to see you, thank you.
And I'll see you tomorrow, John.
All right.
All right, next up.
We're gonna move on to the next agenda item, which is a discussion about possibly changing our meeting time. And Erin, I hope you're here because you're the person who proposed this as a possibility. So, do you want to start off the discussion of this? Is it not
Sure.
working for you?
Sure, no worries if we don't want to change the meeting time. I know before, I believe we met at 1 p.m.
Okay.
Someone with two little kids, it's just, I feel
Thank
bad
you.
when I can't.
You too.
With little kids, I feel bad if I can't attend a 3 p.m. meeting because I have to go pick up the kids or whatnot. So it was just a suggestion to maybe see if anyone else has that problem, or if like a noon or 1 o'clock would be better, or even a morning time. But
Well,
no worries.
I'm the one who sort of, because we didn't have a quorum most of the time. Were missing so many members at one point. I'm the one who said I cannot do 12 or 1 in the middle of the day because I work all day and I can't do it. But if it's on a Wednesday, I can do morning if that works for everybody. I can do 10. I can do any time in the morning. It's just that the minute it gets towards noon, 1 o'clock, 2 o'clock, I'm out. Because I also have deadlines in certain days. So, whatever anyone wants to do, but mornings on Wednesdays are fine for me also.
It sounds
Take a
like
vote.
we're,
Can we take a vote?
yeah,
We
well,
gotta
I
come up
think
with
we
a
need,
time first.
yeah, so the proposal right now is that we have the current time of 3. There's the previous time at 1. And then we have a morning time to be determined. I will be available. I have some Wednesday commitments that I cannot avoid. But they're probably out of cycle with this. So as far as staff is concerned, and Laura, as long as it's during business hours, it's acceptable for Laura, I believe.
Yeah.
So, what are our thoughts? We would require a motion.
Yes,
pick
well,
one, but-
the times that have been proposed are keeping our current 3 p.m., moving it back to 1 p.m., or moving it to the morning, possibly 10 a.m. So are those 3 options?
happy.
And yeah,
I'm happy
Pardon?
with 10. Most of my other meetings are at 10 and they're in the mornings, so I don't care. 10 is fine with me. How about Laura or Aaron?
Does that work for you, Diane?
well, why don't we go around the room and see how many people could make 10 a.m. If it doesn't work, we might try this again, discussing this again at the next meeting, not coming to a decision today. So, why don't we go person by person? Okay, if we moved it to 10 a.m., Diane, could you make it?
Sometimes I get busy at that time doing the boats,
I'm gonna say
bringing
no.
people down to the High Line.
Rocky, could you make it 10 a.m. on Wednesday?
No.
Is that a no?
No, ma'am.
I did.
Said no.
We're sorry,
You
Rocky,
said
you're
no.
cutting
No,
out.
ma'am.
No, okay, no.
Okay. Kelsey?
That would be my preferred. This 3 is definitely hard for any of us with children.
Get that.
So Kelsey's a yes for 10? Okay. Robert Kucharvi,
Yes, I can make it.
Aaron,
Yes.
Arlene?
I cannot.
No, okay. Lisa?
Not ideal.
Linda, yes. Marianne, yes. Okay, we have enough no's that, I'm gonna suggest that we stick with our current meeting time. For now. But
Which is-
everybody give this some thought.
My
Which is
schedule.
totally fine. I just want to send my apologies now. I make a very good effort to be here most meetings, and if I'm not, it's my children.
Well, I
Well,
think
I think we
Kelsey
should-
and Aaron are in the same boat with their kids, and we need to figure out what to do so they can attend because, I hate to have them miss these meetings. Especially
Since we
when
took a vote
Kelsey
on it,
just came
since we took a
on.
vote, since we took
Okay,
a vote
hang
on the
on.
10 a.m.
Diane has
Can
a
we-
suggestion.
Is it 3:30? Is it 3 and up that's difficult for you? Does 3:30 work?
No, they still got to go get their kids.
Target's going in, please. Yes, we're telling you. It's Nantucket at 15.
I think.
Sorry, there we go. Please say again.
Yeah,
Say
the
what?
3 3 and after, it's tough.
It's not,
I've
yeah.
only missed a few. Like, luckily I can figure it out with my husband, but there are definitely times that I can't. And then we only meet once a month, so it's a bummer when I have to miss it. But
Well, I don't like the
Ideally-
fact that the two of you with kids have to jump through
Yeah.
logistical hoops in order to attend this meeting. So we got to
you'll
find
just-
another
You'll
time.
just get used to hearing my kids in the background. That's all.
So I
That's why I
think,
put on mute all the time. I got a 28-year-old who just wanders by all the time because he lives at home.
I think we should definitely look at this. We've stuck to the first Wednesday of every month for as long as I can remember, so it seems like we should stick to that. But it seems like we could probably find a happy medium, like.
Was 12 or 1 out? She had suggested that, but Linda said that doesn't work for her.
Yeah.
As many of us.
I mean, it's gonna be, it's not everyone's gonna be able to make a time.
Yeah,
But I would like to, since we took a vote on people's opinion on 10 AM, why can't we do the same for 1 PM?
That's what I was
Yeah,
thinking
what
too,
can we-
'cause I could
can we
do that.
do?
Just
I can't-
expect me not to be there most of the time.
Well, that's that.
Yeah. I serve lunch on Wednesdays until 1, so I'm at.
so then maybe we should
Does
look
9
at,
work? Oh, let's back up for a second. I do have something, as you know, Jericho. We meet at 9 o'clock for a contract review. Does
Yep.
9 o'clock work after the kids go to school and everybody's sort of released from the hounds kind of thing? Does 9 o'clock work for anybody?
same vote for.
You want to do a vote again?
Yeah, let's try that.
Could maybe a brief show of hands, if Linda is proposing this, so I'm assuming a yes from Linda. If 9 o'clock works for you, raise your hand. 2, 3. So that covers, and Rocky.
Yeah, I
What
could
about
make
nine?
that work, I guess.
Would
We
9,
run in-
does 9:30 make a significant difference for?
Well,
I start work at a place at 9 o'clock.
Yeah.
Monday
Right.
through Thursday, so I can't do that.
Does a day
What about
change?
Robert? Did Robert weigh in on this?
Yes.
Let me unmute Robert. Yeah,
Yes, sir.
there was some background noise. It sounded like he was getting on the boat, to be honest.
I think he was.
Okay, then we'll hold for Robert. I think Robert generally has a relatively flexible schedule.
Really? He works for the.
He's not at the museum. He's at the museum a
Yeah,
lot.
that's museum a lot, yeah. And he's got this off-island schedule now on behalf of the museum.
Or what is it, on the road?
just
That's-
a suggestion, if we stick with the 3 PM, which is completely fine, maybe if we can all be good about letting Mary Ann or Laura know if we're going to be attending or not. Because oftentimes I'll make arrangements so someone has my kids and then there's no quorum and we just sat our
Yeah.
3 minutes.
Yeah,
So that would
Well,
be helpful.
That would help. Okay.
Yes, that's a
So
good point.
let's we'll stick with Wednesday, the first Wednesday of the month, 3 PM. But everyone, please let Laura know in advance if you are planning to attend the meeting, so that we make sure we have a quorum.
In other words, just respond to when she emails us.
When she emails you, let
Yeah.
her know, yes or no, that you'll be able to attend the meeting.
Yep.
Okay.
There is another option, which I've used. Marianne knows that, but even on my flip phone, I was able to figure out how to navigate it. But I was at a couple of meetings because of quorums last summer, and I think the summer before that, where I called in. Jericho has a number that he can give us. You can call in on your phone and be at the meeting and still have the kids and still be picking up people and still going, because I was at the
Okay.
airport twice when I
Yeah.
called in. And that
That's-
constitutes a quorum.
That's what I did before. That was
Yeah.
1 o'clock was really tough for me, and that's exactly what I did sitting in the taxi.
that said, it's not the ideal
No, it
way,
isn't.
way,
but
method to
I
do
did-
governance.
And I was taking notes.
But yes,
Not very
yeah, I
helpful.
can't remember those, but I think it was right when I first joined. I mean, I think I think we should explore this a little bit more, like it could be like 2 to 3 or 2:30 to 3:30 or something like that might make it significantly easier for people. But this is clearly something we should try and iron out for the benefit of the
What time
most.
do the kids get picked up from school? Just out of
After,
curiosity.
anytime after 3, right?
Yeah.
Is it two
Kind of
o'clock?
earlier, 2:20.
Yeah.
Oh, 2 wouldn't work.
Okay, so 2 wouldn't work.
Yeah,
Okay,
okay.
gotcha.
The two would run into the 3:00, 3:30 time for those guys.
Yeah, there's definitely no part of me that would ever expect anyone to change time for me and my children's sake. I will do my best to be on every meeting I can, but definitely might have those meetings like Erin's saying where you just don't make it, or like Linda was saying, you have your phone on or your video on and there's kids in the background or everything's muted. So just full disclosure, I mean, I'll do my best to be here, because I want to be.
We hang with all ages here.
We do.
Moreover, we need to make certain that people in certain classes have access to government, and mothers is one of those categories.
Yeah.
Mhm.
Okay, so we're going to stick with our current meeting time. And everyone will make sure to let Laura know when you receive the announcement of the meeting, if you will attend or not attend. And we'll see how this goes. It could come up for discussion again in the future.
Can I ask a question? Is
Diane?
this only during school time or is this year round? That's a problem with the babysitters? Or picking up children, I mean.
For me, it's year round. My kids are at Small Friends, so it's year
Okay.
You
round.
gotta get them by 3.
Okay, thank you.
Okay, I'm gonna move on to the next topic, which is the Elder Expo. As we had last year, we had a planning committee for the expo, and just so everybody knows, the Senior Expo is October 18, it's a Saturday, from 10 a.m. to 1 p.m. at the high school. So we've already got the venue and the time nailed down. But I'd like to, at least 2 people from the Council on Aging to be on the planning committee. And I have 2 people already from the Center for Elder Affairs, Brenda Johnson and Lorinda LeCain from the Center for Elder Affairs have agreed to be on the planning committee. So I'd like to get at least 2 volunteers from the Council on Aging.
I think it was
Sarah.
Arlene and I last year, and I thought we had another person. I thought there was more than
was.
2 of us from last year.
Aaron.
Weren't you on it? Yeah, Aaron was on it.
I'm happy to help with that. I mean, I know we'll be there as VNA, so I'm happy to help with whatever you need for that.
Also,
We need help that day too. Big brawny
Kelsey.
people helping.
Okay, so Erin, Kelsey, and Linda have all agreed to be on the planning committee. And let me tell you, this means a lot of meetings between now and October 18. I'm just warning you.
If you want me to do the posters and stuff again for
Yeah,
the advertising,
Oh,
I'll
yeah.
do that.
okay,
Okay, so, but I can't commit to
the meeting.
the meetings.
Okay.
So if you or Linda or whoever wanna just feed that to
Okay.
me, what you need, I'll get it to
Yep.
you.
All right, so I'll be
You can just
letting you
bootstrap
know.
off of last year's posters because you already came up with the logo type for that. So we just
Yeah.
keep going with what we
So
did
it's an
last
easy
year.
lift. Rinse and
Yeah.
repeat.
So
And then
I'll
we
be
usually
letting
meet
you
at
know.
lunch, guys. We usually meet at lunchtime and I usually get cookies or somebody gets sandwiches
Yeah.
or
Last
stuff
year,
like
we
that.
had the meetings all at lunchtime, so people could fit it into the middle of the day, and you could eat. The first lunch was on me. After that, bring your own. But the first one, I'll be glad to provide lunch.
Where do you have the
Or
meeting?
cookies.
The
I got
meetings
sugar.
were at the Salt Marsh. Are you gonna come, Diane?
Sure, you'll put me in as like an extra, cause I'd, just in.
Okay, I'm
case.
gonna tell you, if you come to the first meeting, you'll find out it's a commitment. You either
Yeah.
are in or out because it's a lot of work.
Lot of planning.
The day
Yes.
of is a big push because we're in the high school. We get the tables, a lot of them bring their own tablecloths and their signs and their stuff. But it's the entire front hall of the high school and sometimes it's the kitchen as well because they do kitchen demonstration, and then around the corner, they'll do something. They do a hearing. We did have shots last year. Jericho's have to deal with that. There's
That was
a lot of
actually
stuff
Kelsey.
going on.
Yeah, we
That was
did
actually-
lots. Yeah.
Yeah, Kelsey did the senior expo. I was doing
It
crisis
was
control.
very
on
unsuccessful.
protocol.
I would be
Yeah.
interested to hear opinions on doing it again. This year, we were not leaning towards doing that, because I think we literally only gave like 8 shots, which is just
Yeah.
kind of crazy.
I
But
think supply, actually, Kelsey, separate from this, I'm gonna talk to Aaron about our internal stuff. Sorry, not Aaron Lynch, Aaron Schrader. About our vax plans, and we might want to actually talk about this a little more in depth outside of
Yeah,
this
yeah.
meeting. Because I think it's gonna be a weird year on vaccines and I don't know
Agree.
what availability
You
is
don't want
gonna
to
look.
over order by any means, but
Yeah.
I also really appreciate that this is like earlier in the month because I think it would create the potential that we could have them available at the clinic, but still use them for landmark, homestead, things like that, and not have this like surplus in the end. If that were the situation, but well,
They've got a new strain of COVID, so they're suggesting that all of us, over a certain age get the COVID vaccine again because it's a different strain. I just read that
Oh,
this morning.
It's annual no matter what now.
I get it
It's
every
same-
6 months.
Yeah, it's at least annual optimal, especially if you're an additional risk case, is every 6 months.
I want to mention too that Laura will take care of the vendors, and, on that topic, she sent everybody a copy of the, message that she plans on sending out, that you got that before today's meeting, so, I hope you had a chance to look at it. If you haven't and you have comments, you can give them to Laura now, or you can give them to Laura tomorrow in an email. But she has already
Double check and make sure you're.
got her message that's going out to vendors to tell them they have a deadline for reserving a space. And wrangling the vendors is a big part of this whole thing, so Laura has agreed to do that again, and thank you very much, Laura. A huge part of it. So
I
does
think
anybody?
our first meeting last year, I think she gave us that list of vendors and we or sort of added to it people that we thought should be included and stuff. So that's probably something we need to go over again.
Yeah, it's distributed. I think the one with the additions has been distributed. Sorry, Laura, I don't want to talk for you.
That's okay.
But I think we just distributed that and you can probably do that first meeting, right?
Yes, although she can go ahead and send this out now and get those that are on the list, and we can add others later. But if anybody has any suggestions or comments about Laura's email to these folks, now's a good time for feedback.
Mary Ann, could I just send out the list from last year? And so people, because some people weren't here last year, so they don't know who's on the list.
Yeah.
And then they can just randomly email me and say, I think it would be great to have so-and-so, here's their contact info.
Yeah,
That's
great
great.
idea. So you'll
Okay.
just email the list to all of us and we
Yep.
can all comment on it.
Okay.
Okay.
Do make sure that when you comment on it, if you reply, just reply singly to Laura. Otherwise it gets into serial communication issues for open meeting law.
Okay. Any other items related to the senior expo before we move on?
Oh, did you ask the NCEA if they were gonna sponsor the advertising for this?
I'm certain that
They probably will.
pretty certain that NCEA will,
Yeah.
because I've already made the pitch to them and two of them
Yeah.
have already volunteered to be on the
Okay.
planning committee, so I assume if they're on the committee, they'll bring money with them.
Yeah, okay, good. Because they gave us a budget of $5,000 last year for advertising,
Okay,
which covered, I think, posters and things like that. I'll have to pull it up and I'll
Did you
send
run
it
it
to
in the
you.
paper last year?
okay.
I believe we did.
Yeah, we did it on the current.
Current, okay.
Yeah, I have the whole budget for everything left from last year in my
Yeah.
file, so.
So I'll pull it up and I'll send it to you.
Okay,
Okay.
that's
And
great.
Jericho, do you want me to send that to you?
Marion, you can pass it on. Marion can pass it on to me
Okay.
as
Yeah.
well.
All right.
You certainly can. I don't know that I'm gonna be too hands-on on the budgeting part of this
Okay.
for that year, but if there's a shortfall or something, I can see if I can help.
Generally, when I attend their meeting, I propose the budget so that they can all comment at their meeting, so that would be
Okay. I'll
good to
send it
do
to
in
you.
I think maybe their September meeting,
Yeah.
or even this month, it's they're the third Wednesday of the month that they meet.
I really loves the Wednesdays.
Third
Yeah.
Wednesday of the month, yeah. Okay, anything else on the senior expo before we move on to Jericho's report on human services? Okay, Jericho, you have the floor.
I will be brief. It is, we're currently in the planning stages for what our vaccine is gonna look like. Changes in the way that state and federal, grant funding works means that we will not have off-island, mobile vaccination clinics arriving. And we do not know what the availability of, flu and COVID vaccine will be through the normal channels that we were ordering for it. We are assuming that we are gonna do a couple of mass vaccination clinics locally. So we're getting fully enrolled in the state vaccination program, making sure we're all up to date to do our own ordering and storage. And kind of seeing the trouble is we literally do not know what it's gonna look like. Literally last night at like 7:30 PM, there was an announcement that $500 million for mRNA vaccines wasn't gonna be allocated, or that the contracts associated with it canceled, and nobody knows what that means for municipal distribution of vaccine. Past that, human services work we're doing right now, we're gearing up for the next round of contract review committee grants. The grant RFP, the grant application should be out and ready to go by the end of September, with a collection date of end of October. We'll have more updates on that as we get closer to the date, but if you know of anyone who is doing human service related work on Nantucket, and it can be anyone with a 501c that does human services work on Nantucket, Elder or else otherwise, can be applying for that process. Other stuff is primarily in the health side. We've had some concerns about tick-borne illnesses. We recently did, in the other room over there, actually, a long-term Lyme disease study that we're gonna be doing hopefully annually for the next 5 years. And then it is just a lot of summer, like maintaining over the course of the summer as we get ready to do the planning and grant cycle, and then get ready for summer, like for the winter seasons. If anyone has any questions on human service stuff, or as always, anything about the town, feel free to ask me either in the meeting or afterwards, and I can at least try and get an answer. We are often a very opaque organization, so if there's questions about how stuff's going, please feel free to ask.
I have a question. So as we go into the Elder Expo, one of the huge draws, of course, is always these flu shots. It sounds like you're not absolutely certain that you will have flu shots this year.
So, yeah, I mean, last year we were given guidance to order close to like 300 vaccines or something like that, expecting this huge boom, and we, I think, administered like I said, like 8. And so it's hard to plan without knowing. I think that we did have great success with our clinics that we did at the senior center. So maybe that's something that we do instead, or maybe we have like 100 vaccines. I don't know. More to come as Aaron and my company and Jericho and I collaborate and figure out the best plan. We just don't want to end up with surplus and excess that literally got wasted. So it's unfortunate.
Yeah.
It's only flu shots, right? Not COVID. It's only flu, not COVID. Yeah, both. All right, because I can't take the flu shot.
Yeah, we did. I know we did both, at least when we did it at the Saltmarsh Center. I think we had both at the expo, but maybe just flu.
I think you guys had flu, and then we did the flu and COVID at the other site at the same day. The first clinic we did lined up with the senior expo. On our end, I don't know how, not that it's, we should be able to order vaccine as a municipality at some point this fall. I don't know how or what that situation is going to look like, because that supply has always been backstopped by federal money, which is not being dispersed for that at this time.
Okay.
Kelsey, I think you guys did private purchase on your Vax doses, so that's a different supply chain, but it's also much more expensive when you're not getting a state sponsored vaccine.
I was one of the 8 people that got my shot and I came to help you, but I think it was 10 to 1. I think I was like 11:30 to 1 or something. So like I walked through real quick, but I just asked you like, what can I do to help? And it was pretty quiet by then. And the flu shots were like way down the hall. So it's like they either need to be right when you come in so people see them or just advertise more. So I was actually like pretty happy to be able to get my flu shot.
What saved
I
you?
also think last year, this, if I remember correctly, this one was after the hospitals and the hospital was doing them too, like 2 weeks earlier, whereas now you guys are actually 2 weeks ahead of the hospital. So you're gonna get the people looking for them mid-October versus like early November. So you might have
the doors.
But it was very convenient. It was just, I know there was a cooking demonstration, but that was over. So if you didn't sort of know, and I was just walking through because I was there to help.
When
And I went,
I
oh, I can get a flu shot. This is great.
I think there was also confusion because we were running a concurrent flu and COVID
Yeah,
clinic
that was
on the same day in a
confusing.
different location.
Okay.
Plus there had already been the hospital's health fair, which had included, I think they might have gotten a couple hundred out through that. Plus they were doing subclinics elsewhere. We unlike the early days of COVID where we were all coordinating directly on who was doing what, where, and what sectors we were covering, it's slid a little bit more because of the transition from the pandemic period to post-pandemic. And that I think made it less coordinated across different agencies. So that's something we're gonna try and be more on top of this year too. But I think it is important for people to realize that the method in which they got flu in previous years is gonna be potentially very different. Flu vaccine, not the actual disease, because it is an unprecedented change in the healthcare system of the US, specifically on vaccines.
What do you mean by
You
that?
think so? You think so? He just got rid of something else this morning.
Half a
MRS or
billion,
whatever it is.
half a billion of mRNA vaccine research, including a bunch of candidates for cancer prevention vaccine. There was an AIDS cure or AIDS vaccine and a treatment that was potentially a cure or equivalent thereof. But essentially, we have in the head of the American Health Agency is skeptical of the efficacy of vaccines personally, which means that he is unwilling to allocate resources to vaccination for a variety of reasons that date back to the Wakefield study in the 80s associating vaccines with a bunch of chronic diseases.
So
Dates back to the dark ages.
That too.
are you saying the availability? Is
I
that
am
more concerned with when you say the authenticity? You don't mean the vaccination?
No, the vaccine, so the vaccine is being developed in the same way as it always is. It is gonna be, it is based on observations of strains in the southern hemisphere during their winter, which are then used to formulate a vaccine calibrated for what the expected variants are for that particular year. Normally, for an example of what I mean about the unprecedented nature of it, generally the decision on which strains are going to be vaccinated against is made in the US by the Health and Human Services Department sometime around February or March. That meeting was canceled on 24 hours notice and never reheld. So the manufacturers themselves are deciding which strains are vaccinated against. It is not a service being provided by the public health organizations in the US. Likewise, last night, on very short notice, a bunch of money that was already allocated for a specific technology for developing vaccines was pulled and those contracts were canceled unilaterally because
That's gonna go to court. That's gonna go to court because they already allocated the funding and that's going to court.
Oh, it certainly is, but the researchers and the programming can't wait. There are postdocs, there are researchers, there are labs that will have to stop because they can't draw money to pay salaries or keep electricity on for the programming that as it was determined. So that is a fundamental difference in the way that vaccines are being not manufactured or not selected, but distributed. most vaccine that was distributed through the public clinics, all the vaccine that came out for COVID until like a year or two ago, was all essentially purchased in bulk by the federal government, distributed through supply chains to individual states, and then offered at discounted rates to those who are uninsured. It gets really deep into the fiscal structure of this kind of work, which is unbelievably boring unless you are like directly working on it. And incredibly frustrating because like a big pool of money here, but you can't use it over here because this use case is limited for this, et cetera, et cetera. All solid governance things. But at the core, if the person who makes the major decisions for the primary federal health agency does not believe in the efficacy of a particular medical technology and is active in working against that technology for reasons that are not evidence-based, then it doesn't matter. It's, you know, at the top, it could be unlawful, but it's not the only unlawful thing that's happening at the federal level at this point.
No, and he said he wouldn't do that when he was doing his interview before Congress, so he lied. So there you go.
Yep.
Big surprise. I knew this guy when he was younger. Big surprise.
I was going to be brief on this, but yeah, sorry.
Thank you.
Well said.
Laura, you are next up and you did send your report in advance. So, I'll just ask people if they want to comment or if they have questions for you. And then you can say anything else you want to say. Any questions, comments for Laura?
Nope.
Laura, anything you want to say to us?
Nope, not at this time, but I'm very excited that you guys are getting the Elder Expo organized. I think that's fabulous. Have a lot of.
Since you're going to be in Thailand.
Yeah.
Ahem, ahem.
Sending us pictures from Thailand. No.
I will.
We have
Okay,
lost Robert.
we've lost
he's on-
Robert
I
and
think he's
he's
hopping on the boat, so he lost connection.
okay.
Yeah, he's probably in the middle.
Okay. Not okay, but he can catch up with us next month. Unless anybody has anything else that you think we need to discuss today, I'm gonna ask for an adjournment.
So move, Madam Chair.
I
Thank
second.
you. Second. Okay, I have to take the roll again. So if you agree to adjourn, say yay. Diane.
Yeah.
Rocky.
Yay.
Kelsey.
Yep.
Robert.
She's
is
not
lost.
voting. She's not voting. She's not
Oh,
voting.
yeah. Yeah, she hasn't been.
Oh,
sworn in
that's
yet, so
right.
she-
Aaron,
Yep.
Arlene,
Yes.
Lisa,
Yes.
Linda,
Yep.
Linda. Yes, Marianne, yes. Okay, thank you very much, everybody.
Thank you.
you.
See you next month.
Thank you.
Thank you.
Bye, everyone.
All right.
Marianne, sooner. Marianne, set up a meeting for the committee sooner than next month. We should have a meeting this month.
The planning committee for the senior expo.
What about setting it up?
Sooner.
You want to set a date?
Before, not, we can't now because it'd be business that we'd have to do during a
Oh,
declared meeting.
okay.
but
Not next month.
I'll tell Marianne about a meeting before next meeting to start the planning process.
Oh, definitely before our next meeting.
Yeah, that's all, that's.
Sooner the better. Yeah.
All right, bye, Linda.